Hi, it's Dr. Epstein with a patient who's 11 months out from 1,600 or something, and change FUE grafts. Mostly did it to restore his frontal hairline. He's very happy. Obviously wants to be private about it, as most of my patients do. We did his first procedure, 1,600 or a little over 1,600 grafts. You can see how thin he was with both frontal temporal sessions. And here he is today, really happy with the density that we were able to achieve. We were able to get some nice density there. You can bring it around this side, Cindy, and you can see here. You can see what we're able to do with all this is transplants where he was really thinned out. We also did some throughout the back areas too. So overall, we were able to get a nice improvement in density. You can come around here, Cindy, just in the back, just so we can see the back of his head. Turn this way just a bit, and you can't even tell anything was taken out from back here. The plan is with him is to do potentially a second procedure, fill him in a bit more. And that would be a procedure of probably around 1,000 grafts. We're going to focus on here again. We're going to use a no shave approach. This way he can be presentable the very next day. We won't be shaving anything, just removing the grafts from back there. Anyway, this is Dr. Epstein showing post-op 11 months from a 1,600 FUE procedure. Thank you very much.